In Good Shape, your health magazine on DW, featuring an interview with a different expert every week.
I'm in the Schlossberg Clinic Berlin at the Department for Neurology, and I'm with Professor Thomas Lempert. Thanks for inviting me into your clinic.
Hello.
I'm a GP myself, and I see many patients with the complaint of dizziness or vertigo, and sometimes the patients just sheer panic because they're so afraid of this condition. So how dangerous is it?
Normally it's not dangerous at all. Patients often have a sensation of panic, as you tell us, but normally it's totally harmless. Only 1 or 2% of dizziness patients really have a severe underlying condition.
So it's all about the underlying condition and not about the symptom.
Yes.
And how do you diagnose the underlying condition?
So most important is spending time with the patient, listening to the patient and asking the right questions. So one question would be, what type of dizziness do you experience? Any spinning, a vertigo type of dizziness, or just a general dizziness? How long do your attacks last? Do you have extra symptoms like hearing loss or tinnitus or neurological symptoms? And if I know enough about the dizziness as if I had experienced it myself, then I usually know what the diagnosis is.
So you nearly feel the diagnosis yourself.
Yes.
After this, yeah. And if you don't know it by then you're putting the patient into this kind of lab. We're standing in here right now.
Now the step in between would be to do a physical examination, because often I can see by hand what's wrong. But often I use the lab as well to specifically check the vestibular system, the balance system in the inner ear. Okay,
so we have a very healthy young man today with us. He's not a patient and he doesn't complain of any dizziness, but you can show some of the examination you do here.
Yes, and the core test probably is the caloric test, which means that by temperature you can activate your balance organ in the inner ear or can inhibit it with cold water or warm water, and then we measure the reactions of the eyes. So an eye movement would be the expected response, and if he doesn't have a response on one ear but on the other one, I would know that he has a loss on that, a functional loss on that side.
So how do you feel right now?
It's dark, but I'm fine, no sickness and no dizziness.
So this kind of machinery is not usually in the setting of normal practice, GP practice. But what we do have actually there is this kind of glasses, which is called the Frenzel glasses.
Yes.
So what do you do with those?
Yes, they serve to enlarge the eyes. At the same time, the patient doesn't see right through these big lenses, and this helps us to observe the eyes, and also the patient cannot fixate.
So if I would have a vertigo right now, if I would feel dizzy, you could see it in my eye movement.
Yes, we can make you dizzy easily.
Okay, how's that?
You can simply turn on the spot just 5 times, and then we'll see what happens.
Okay, it's a medical merry-go-round.
Okay, and right on this spot, you turn around 5 times. Yes, very good. 2, 3, 4, one more. And now stop and open your eyes. And we can see your eyes beat to the right side. This is what we call a nystagmus. And a nystagmus indicates that your balance organs are activated.
Which is hopefully a good thing after I turned around.
Yes, this is a healthy reaction. But if you see this in a patient who has not moved like you did before, then you know something's wrong in the balance system.
So this is one of those examinations you do on a frequent basis. So feeling dizzy or the vertigo is a thing combined of different systems in the body. One is the eyes, one are the ears and the muscles and the brain, and it has to work together in a very special way. Meniere's disease is one of the causes of vertigo and dizziness, but there are different causes.
Yes, there are quite a few, and the very harmless one would be circulatory collapse or a pre-syncopal feeling where you almost faint when you get up too quickly. But the more common causes may be migraine, but also positional vertigo, which is short but very intense spinning whenever you turn over in bed or when you get up from lying.
And how do you treat the feeling of dizziness?
First you have to find out what it is, and then, for example, if you have circulation problems, you try to raise the blood pressure. But when it's migraine, you may succeed with medication, but very often you don't need medication and instead you use physiotherapy. For example, positional maneuvers for positional vertigo or balance retraining programs. It's very important to activate the patient. There are exercises that patients can do at home, and this is very effective also psychologically if you can do something for yourself.
And you can show us the maneuver how to get rid of positional vertigo.
Yes, that's easy. Please come in and have a seat here. So I would ask you to lie down to that side and first turn your head to the opposite side. And now 1, 2, 3, go. And look at my forehead. And then I watch the patient's eyes, and when they start to beat a nystagmus like this, then I know it's this ear that has got positional vertigo. And
the left ear.
Yeah, the left ear.
Because it's the ear which is
down.
He's not moving his eyes at all?
No, he's healthy.
He's healthy, good for you.
But if I had seen the nystagmus, I could immediately do the therapeutic maneuver to relieve him.
So we could simulate that?
Yes. So we try it. 1, 2, 3, go. And there he is. That's the second position. And he just rests there for another 30 seconds.
And this is because there are tiny little crystals inside the ear, the inner ear.
They are displaced, and by that maneuver, and there are other maneuvers as well, but by that maneuver I can reposition them to where they belong. And then finally patient sits up, and that was it. For 70% of the patients, just a single maneuver is enough, and otherwise you do a few repetitions.
So it works like magic. Yeah. Physiotherapy is another way to treat different causes of the symptom of dizziness. So you can show some practices here. Okay.
So almost any type of dizziness that that goes along with a balance problem can be treated by physical exercises.
He's on a cushion.
Yes, you don't need extra equipment, and the role of the physiotherapist is to customize these exercises to your limit of capabilities so that you can expand your balance functions. And when patients have learned this and have a little program for training at home, they can do it every day, once or twice for several minutes, and then they will improve and they will feel a lot better.
And even if they don't suffer from vertigo or dizziness, if you grow older and you practice it, you can prevent falls.
Yes, absolutely. We know that physiotherapy works in an excellent way to prevent falls and hip fractures.
So it's a good thing to start this today, even if you don't feel dizzy. Thanks so much for inviting me into your clinic.